Pennsylvania. Welcome to our show, Good Morning Bloomsburg, with Peach and Pear blooming.
I'm Peach. We're gonna kick off this morning with some slapping weather reports. Even though we are landlocked, doesn't mean we can't enjoy a bit of beach weather. Coming to you live from our sister Pearl. Take it, Pearl.
Don't take risks on treacherous roads and don't swim in the sea. Incredibly, people have been spotted in the water here in Blackrock and Salt Hill both today and yesterday.
Do you think she's alright?
Oh, she's been hit multiple times by many signs. No worries.
Alright, thank you, Pearl. Now for our main segment on strokes. Dear sister, do you think you could advise the nation on what signs and symptoms of stroke could possibly be?
Why, of course, dear sister. Nothing would bring me more joy. Sudden numbness or weakness in the face, arm, or leg, especially one side of the body. Sudden confusion. Trouble speaking.
Difficulty understanding speech, sudden trouble seeing in one or both of your eyes, sudden trouble walking, dizziness, loss of balance, or lack of coordination. Also, sudden and severe headache with an unknown cause. No known cause.
If you experience any of these symptoms, it is important to call 911 right away. What happens if you have some of these symptoms and we go to the hospital, Pear?
Well, you see, there's a simple test that you can do called FAST. F stands for face, A stands for arms, S stands for speech, and T stands for time. So you want to take a little time and let's show people what this could possibly look like. Alright, so I'm going to ask her if someone with a stroke to smile. That's what you ask for face. And if it's drooping, that is a possible sign of stroke. Now we go to the arms, and she's going to raise both of her arms. And if she had a stroke, as you can see, one side would be drooping and not able to be level. Then we go to a simple sentence, her speech. Does the brown cow go over the moon?
Moon jumping does not.
So that could indicate that she is having stroke. Now you want to record the time at which these symptoms first occur so you can tell it to 911.
Bring, bring.
At the hospital, nurses and doctors will take great care of you, running diagnostic tests to rule out whether you have a stroke.
That's good. So, let's transfer you guys to our sister Parsnip. Yes, Parsnip, Peach, Pear. Our family loves fruits and veggies. Anyway, Parsnip is going to give you the rundown on what the hospital will do once you arrive.
Try it again. Take one. Alright. Hi, Parsnip. My name is Sam. I'm an EMT with Valley Regional. I'm going to be taking care of you today. Can you tell me a little bit what's going on?
So about an hour ago, I started with a really random headache. It came on rather quickly. And then, I started feeling dizzy. And I noticed that the right side of my body was a little bit weaker than normal. But I thought that maybe it was just exhaustion from work today. So I just laid down for a nap and I got up and I felt a lot better, but I was still a little bit worried. So I Googled it and the internet told me that I might have cancer. Am I gonna die?
Oh my goodness. We get so many patients like this. Never look on the internet. That's just going to lead you down the wrong road.
Okay.
So what I'm going to do first, I'm going to take some vials. That's going to be your blood pressure, your pulse, the oxygen levels in your blood.
Okay.
That's going to help me start to determine what's going on here today. if I can see a finger. Okay. That's going to take your blood pressure. Now, do you have any past medical history that I should know about, or any medications you take daily?
Yeah, I do have high blood pressure, and I do take meds for it, but nothing else, though.
Okay, good, good. You haven't had any falls or hits to the head recently, anything like that?
No.
Okay,
No.
okay. Alright, good. So your vitals are checking out okay. Your pulse is a little high, but that could be from all the excitement going on. So what I'm going to do now is perform a fast exam on you. What this is going to tell us is if there's any immediate signs of a stroke, okay?
Okay.
So what I want you to do is hold your hands up in the air and then close your eyes. Okay, good. Now if you could take down your mask for me and give me a big smile. Stick out your tongue. Okay, good. You can put your mask back up. So with your vitals looking good, and since you said that your symptoms came on rather quickly and that they resolved also rather quickly, I'm going to kind of suggest that you might have had a TIA. And what a TIA is, it stands for a transient ischemic attack, and that's a type of stroke. It's also known as a mini stroke. These kinds of attacks should be taken as a warning sign for a much larger stroke, which is known as an ischemic stroke. And that is when you have a blockage somewhere in the brain and it cuts off the circulation and the flow of blood. And now why I asked you is if you had any head trauma, is that could also cause a bleed in the brain somewhere, and that's called a hemorrhagic stroke. So I don't think you're having a hemorrhagic stroke. So that's why I'm gonna go with more of the TIA. But okay. I'm glad that you called, because this is something that you definitely want to get checked out.
Okay. What are you gonna do for me at the ER?
So what they're going to do is monitor your vitals like I am as well here. They are going to do some blood tests. They're probably going to take you for a CT scan or an MRI of your head, and that's going to be able to paint a picture of if there's anything going on internally, and that might also show a sign of a stroke. Now, if you had a blockage with the ischemic stroke, they would have given you a clot-busting medication that would have broken up that blockage that you had if that was an ischemic stroke. Now for the TIA or the mini stroke, you probably did have a blockage somewhere, but it relieved itself on its own, hence why your symptoms relieved so fast.
Okay.
So we'll get you up there quick and get you checked out.
Okay, thank you.
Okay.
Thank goodness our sister Parsnip took that overtime and didn't go to the beach today. That would have been a tragedy. Because her head, not so hard. Anyway, thank you, Parsnip. We're now going to transfer you to my other sister. Take it, Pear!
Different measures you can take to prevent stroke are as followed. Don't smoke and avoid secondhand smoke. Treat high blood pressure if you have it. If not, so make sure you get your daily blood pressure done. Eat a healthy diet that's low in saturated fat, trans fat, added sugars, and salt. Be physically fit and active. Reach and maintain a healthy weight. Control your blood sugar if you have diabetes. And most importantly, follow your doctor's orders for taking medicine and get regular medical checkups. Remember, Geising Hospital is your friend.
Good job, sister.
Okay. Thank you for joining us on our spectacular show today. Good morning, Bloomsburg.
Good morning, Bloomsburg. We hope you had an educated morning. Till next time, join us on Twitter, Insta, Snapchat, or Facebook. We're also thinking about adding a TikTok, so look forward to it. Have a blessed blooming day. Good morning, Bloomsburg! Till next